Hello, I'm Joanne Stocks from the Arthritis Research UK's Pain Centre at the University of Nottingham. I'm going to share with you some of our research on the relationship between sleep and pain after total knee replacement surgery. Osteoarthritis is the most common disease affecting the joints, causing pain and disability. It is estimated that globally, of people aged over 60, 10 to 15% will have some form of osteoarthritis. People with long-term pain complain of disturbed sleep, which leads to increased blood pressure, diabetes and obesity. Total joint replacement is one of the most effective treatments for improving the quality of life of people with severe osteoarthritis. However, many people who have had total joint replacement still experience pain and disturbed sleep. Neuropathic pain is a type of pain which arises from signalling problems from the nerves to the brain. Changes to the nervous system can cause neuropathic pain-like symptoms, and 25 to 30% of people with painful osteoarthritis who have had total joint replacement still report symptoms of neuropathic-like pain. This study aimed to discover a possible link between long-term joint pain and sleep, and to see if neuropathic-like pain symptoms play a role. We assessed 423 people with osteoarthritis who had previously undergone total joint replacement. By analysing their responses to questionnaires sent 3.5 and 6 years after surgery, we found that in these people there was a strong link between long-term joint pain and disturbed sleep. We also found that increased incidence of disturbed sleep was linked not merely to the presence of pain, but specifically to neuropathic-like pain symptoms. We also found that in previously pain-free individuals, disturbed sleep increases the risk for developing new long-term pain. So what do these results mean? Pain-relieving strategies which target neuropathic-like pain after joint replacement surgery have the potential to improve outcomes by both improving sleep disturbance and joint pain. Our study also shows in people with osteoarthritis who have undergone total knee replacement that neuropathic-like joint pain predicts poor sleep and vice versa. You can read more about the study in our paper Bidirectional Association Between Disturbed Sleep and Neuropathic Pain Symptoms, a prospective cohort study in post-total joint replacement participants in the Journal of Pain Research. We would like to thank all our research participants who completed the questionnaires and to Arthritis Research UK who funded the study.